I am Parajat Day. I'm a consultant in diabetes endocrinology. I work locally in City and Sandwell Hospital. So it's about 45 minutes from here. And I've been involved with diabetes for the last 20 years now.
So what sort of changes have you seen over those 20 years working in diabetes?
Quite a lot. We've had lots of new drugs come about in type 2 diabetes. I mean, it's amazing how many we have now, and the evidence for these drugs in terms of protecting the heart, the kidneys, and for the first time prolonging lives. So there's been a huge change in type 2 diabetes management, and of course in type 1 diabetes, gadgets, technology, CGMs, there has been a sea change, and I can imagine it is difficult for patients to keep up to date because it's tough for me to just understand the research that's going around in diabetes. So very exciting times.
So you're doing a Q&A session today?
Yes, I have been doing this for the last 4 or 5 years now, and I think it's a very popular session where we get all sorts of people and patients with diabetes sitting in, and it's a free question and answer session. You can ask any question you like, and I think people with diabetes love this because it can get very, very individual, but a lot of queries come about, and it's nice to sit and talk to them almost as if you're doing a clinic. And I'm ably guided by my fellow diabetes specialist nurse, Joe Lloyd, and we've been doing this session for the last 4 or 5 years, and we really enjoy it.
And I think the session, I remember from last year, you very much talked about the drugs. You mentioned some people are averse to starting on drugs, but you said at the time, hang on a minute, these things are life-changing. You said life-preserving.
Yes, I mean, there has been a change in how we manage diabetes these days. Gone are the days when you think about just diet and lifestyle, because you're just prolonging the inevitable. So we've got to come in quite hard early on. So along with diet and lifestyle, which has got to be the cornerstone throughout, we like to introduce drugs early on because the evidence is so great in terms of reducing complications and in terms of longevity. So we want the best for our patients, and that's the evidence we like to discuss and encourage patients. But it's discussion. And if somebody says, I'm going to go for lifestyle, fine. But there has to be a finite time period and say, look, it's working or not working for you, let's move on.
And what difference does a day like today make for people living with diabetes?
I mean, you just need to turn around and see the amount of people who have come in, okay? People with diabetes, people related to diabetes, to realize the value of how a chronic disease manifests, how many lives it affects, and days like this, puts everything into perspective. That, yes, you can come to the clinic, see a professional, but you need to be aware of wellness days, research foundation like this, and talk to fellow people, and you gain such a lot of knowledge and insight about your own disease, because this is a disease for life. A professional will only be able to tell you so much, and you have to gather little bits of information from fellow people, and a day like this really puts all that together very nicely.